Good morning. Time now is 7:43. Polluted air after the fires in North County can cause some health problems. Dr. Chaffoo joins us this morning with how long we can expect these poor conditions to last. Doctor, good morning. Always good to see you.
Good to see you too.
I struggled with this last week. I went on air with this. I felt like I couldn't even breathe. What are some of the most common issues that people are going to be dealing with right now because of the fires?
Sure, Shally. So you hit the nail right on the head. The big thing right now is when the air quality is poor, when there's a lot of this particulate matter from smoke and wildfires, we're going to see irritation of the eyes. There's going to be excessive tearing, drainage from your nose, runny nose, a cough, a sore throat, actually somewhat like cold or allergy-like symptoms, because these little particles can travel through the air and you may not see them very clearly, and they can cause significant problems with breathing.
You talk about that. At one point, I myself thought I had maybe a cold instead of this. How do you know if your symptoms are because of the air quality versus that you got a virus or you have a cold or something?
Well, you're right. The symptoms are very, very similar. But of course, if you have more of a cough and if it's an irritation that's more related to the weather conditions, then that's more likely related to the fire. And of course, the closer you are to where those unfortunate fires occurred, and where there's more particulate matter and more smoke and dust, your symptoms are going to be worse.
I've tried to close all the windows in my home.
Yes.
Are there any other things that we could do to protect ourselves until this? And then how long is this air quality going to be like this?
Sure. So the thing, Shally, the public can do is, as you said, close your doors and windows. If you're in your car, hit the button for recirculation. The same thing in your home. Make sure your filters in your home are clean and new. And remember, if you have to be outside, limit your outside time because of irritation. And if you have underlying lung problems, the problem with this, the particulate matter affects the extremes of age. So the very young, the elderly, people that have health problems. And then if you're gonna wear a mask, if you really absolutely have to be in an area, you've had a home damage, you've got to go back and retrieve items, make sure that you get something called a particulate respirator. So just taking a bandana and weighting that, putting it around your face, or one of the surgical dust masks that you might find in a store are really not effective. They will not filter out those particles.
Dr. Chaffoo, always good to see
Good
you.
to see
Thank
you
for the advice.
Sure.
7:45, let's get you outside to Raul.
Okay, a lot of people order the products for Christmas.